Dear colleagues, my name is Markus Trolch. I'm dentist and physician and oral maxillofacial surgeon from Ansbach, Germany. During the COVID-19 crisis, there has been a severe discussion how risky dental sprays and aerosols might be to the dentist and the team and also the subsequent patients in the office. So what we do daily is we are focused on surgery, especially on non-healthy patients, on augmentations, implantology, on jawbone pathologies, and of course the treatment of nasal and paranasal sinuses and oncology. However, we also have to focus on Sars-CoV-2 as it actually affects our everyday work. In Germany, dentists and surgeons have been open during the pandemic, so we had extensive contact with patients. What do we know about that virus? Now, it's not a new virus. It's a virus that's been known since the 1930s in animals, in 1960s in humans, and has ever since been researched. There's a large group of these viruses that are known, and the new strain, the SARS-CoV-2, is a beta coronavirus with an approx diameter of 125 nanometers. We know that it's transmitted via droplets when a patient breathes, maybe, when he talks, when he sneezes, when he coughs, and that these droplets containing the virus have to get contact to the mucous membranes, especially of nose and oral cavity, and maybe also the eyes. So that's the areas we have to protect. There is data from hospitals. This one is a Chinese study that show that around the patients in the air and also on surfaces, virus can be found, and it is assumed that this might be infective. There's no proof that it is, but it might be, and from the virus spreading that way, it's highly likely. That study also showed that the precautions worked well and that we can work on that. The WHO claims that airborne transmission itself is not reported. Of course, droplets are sure that they actually transmit the disease. So we have to distinguish here between droplet transmission, which is larger drops that are just spitted out by the patient, and the airborne transmission, which is virus particles that float through the air, maybe even for minutes and maybe hours after the patient has left the operatory. So we know that our splatter is dangerous to us. Measles, tuberculosis, and SARS were considered in 2004 already. And we also know from the literature that our suction techniques can actually protect us from that. So we went into that and had some special camera settings to actually have a look on these splatters that are produced. Now, the foam that you see here, the spray goes up nearly to 1 meter in height. And after we cut down the water, you see how long these droplets have to take down to come down from the air, right? They're all the time. Now, next setting, we do the same thing again. We spray nearly 1 meter up into the air. We have water spray everywhere. Then we cut the water, and then we come in with the suction. And you can see how the droplets are sucked in, but only where the suction is. Here, it comes down again from the roof. And now the third setting is we spray and we get closer and closer to the suction, and you see especially the little droplets that are sucked into our high volume suction, and thus demonstrate how efficient that can be. Of course, there's still spray around there. We reduced that now from nearly 1 meter in height to this size, and now it's important after we cut the water, the droplets are gone immediately. That is extremely important, and we need to transmit that to the oral cavity, right? This is what happens if we don't use suction. Little droplets of water in the air of all sizes everywhere. And the closer we come with that, with the suction, first the tiny particles and then even the larger ones get sucked in. In the oral cavity, here you can see with suction on a very concise stream of water coming from the handpiece. And here everything's foggy. In this case, we deactivated the suction. Again, to compare with an active suction, no fog, very clear picture, whereas everything's foggy on the non-active side. Thanks to Louise Mortag, she's working with us on a regular basis, and she's a brilliant photographer and without her, these shots could have never happened. Now we have lab experimental papers that show us that the aerosols and surfaces can stay infectious for a long time. This is a very important study as it hints that we have to be very careful in this. However, clinical studies could not tell that these viruses that can be collected around the patient can actually still transmit the disease. This is not coughing, right? This is just breathing, so aerosols, not droplets. Droplets contain the disease and transmit it. This is all for just air swabs around the patient. Furthermore, we know when we come to the surfaces that our normal disinfectants, the ones we have been using for decades in the dental offices, work absolutely fine against this virus. But we also can see that chlorhexidine rinse is not that effective, but hydrogen peroxide is very effective. So in our office, we use 1% rinsing for every patient for 1 minute prior to every procedure we do with the patient. When it comes to sterilization, we can see here that it is deactivated by 60 degrees for 30 minutes. Every sterilization procedure goes above that, so we have to do nothing else. And also very interesting, we know from the literature that just venting our rooms with fresh air is very beneficial. This protective setup is not enough for COVID-19 as the eyes are not protected. This is how we treat patients when splatter and aerosols come with goggles, with mask, with cap, and with disposable gowns. So allow me to summarize. We know that this enters through the mucosa and that our suction techniques can really help us on this point, thanks to all the teams around the world, dental teams, that help us in our everyday life and thus protect us also from infectious diseases, right? Our standards for hygiene are the same, so the virus is deactivated by whatever we have been using before, and we know that fresh air is beneficial. I hope you enjoyed it. Thanks for staying with us, and if you have any questions, direct them to this email address. Again, thanks for being with us. Bye-bye.